You're quite welcome.
Are there any more questions, like for chaplains or mentors? Anyone want to contribute anything?
I have a question.
Yeah.
I'm not really sure if I should hold this for the second panel discussion or CPE, but in telling my story, I talked about how the mind affects the body. And if you have a healthy mind, then you can have a healthy body. So I learned that over the years. I had to do my own research. I had to study, and I wanted it, so I got it. So what do you all have to say about that? Because that's something that a lot of people don't talk about. And then I talked about depression. That's such a big stigma on depression, which I think is decreasing now compared to years ago. But I have not wanted to tell my story, because if a person look at me, they think, well, she's just normal. She looks healthy. She talks okay. But I've had challenges, and I feel like when people share that story like I did, that may bring more people forward to want to be healed and to want to share that story. But saying all of that, basically, mind over matter, and realizing that if you have a healthy mind, you can have a healthy body. Can you all share some information with me on that?
Depression is a affect disorder, which means that it affects that part of the body. Dysthymia and major depressive disorder, bipolarism, when you're swinging between two poles. Those are some of the things that we got bipolar 1, bipolar 2. But the biggest thing that they don't talk about is some of the other things, histrionic disorders, and go on there. But you have to look at what methods are out there in order to treat those. They only have one method. Let's sit down and let's talk about it. They're not going to throw you a pill. Now, after a while, then you don't have to talk to me, then I'll just keep flipping pills at you. So what do we need to do in order to understand, get a better understanding of what dysthymia is, major depressive disorder is, bipolarism, histrionic? Do they need different methods of treatment? The major treatment is is talk therapy. Now they're involving EMDR, eye movement resuscitation reprocessing. Now they're trying to put in prolonged exposure, this treatment. So they're extending that in terms of being able to find out why depression is there. If it's something that is inherent within the structure of the family, then you have to get a better understanding of what it is.
I appreciate your explanation, Ted. With my training, and I'm always going to look for the story that is causing the depression, because usually there's, like I said before, the bottom layer underneath that grief, the very first thing, oh, I remember when so-and-so didn't treat me right, or I remember when so-and-so treated her better, or I had a case where a patient lost the father. The mother died before. And she was working at this, I'll say diner, just for the sense of saying it. And she didn't get along with her boss. So I got to the bottom of the story and said, okay, when did the anger start? Oh, did it start when your dad died? Because he died second. No, it started when my mom died. Why? Why are you angry with your boss? Because your mother just died. I figured you'd be angry because your mom died. She said, no, because my boss reminded me of my mother. So I had to dig down below the grief. Because as a pastor counselor, we do that. We go below the grief to see what is the foundation of why they act the way they do. And until you get the person to realize and say, you cannot tell them to say it. You have to fish and ask those questions that will cause them to say, aha, that's the reason why I'm doing what I'm doing. That's why I'm angry, and I never thought of that. And usually when it comes to that point, I have to bring out the tissues for the person. Because of that realization that all this time, they never realized it. It was because of the narrative, the story, that we're able to see what's going on. So that's why the narrative story, as you say, I don't know what you call it in your terms, but for me it's a narrative. And the narrative is what is going to get them to the point of healing. You have to start there. So in answer to your question, you have the physical, you have the emotional, you have the psychosocial, you have the spiritual. All of those intertwine to determine how you're going to react to your situation. And you have to talk to each level. You can't just talk to one.
And I
Thank
shared
you.
with Linda too that our daughter has lupus also. She was diagnosed at 16, 17. We didn't know what was going on. We just thought she was just another lazy teenager that didn't want to do anything and didn't acknowledge the pain and the depression that she was going through. And we were only aggravating that further by demanding things from her that we thought she should have been doing, but she wasn't capable of doing. So more education, because at the time the doctors didn't know what it was. It was not diagnosed as lupus. A couple of years later, it was diagnosed. If we had had that knowledge before, her transition into accepting the fact that she had lupus would have been a lot easier on all of us, not just her, on all of us. And I regret that.
And Dr.
Thank you.
One other thing too, especially within our culture, in the African American culture, I don't know about other culture, I'm familiar with my culture, is that we do not like to tell people we need help. We do not like to tell people we are hurting. We always have this facade of, oh yes, I'm strong, everything is fine, but inside's like this, your head is like this, and your body's following suit. To the point where you find yourself flat like this piece of cloth. It doesn't have any body to it, it's not moving, and you can't live like that. So when you hear or you see somebody saying, I don't want to live anymore, you have to ask those important questions. Do you have a means to kill yourself? Do you have a plan to kill yourself? When was the last time you thought about killing yourself? What was the outcome of that? And that will determine, you must refer to a psychologist. You must. Chaplains, we are mandatory reporters, so we must refer. Because we are not, unless you're a licensed psychologist, you cannot do that. You have to refer to the people who know how to do it. Or tell the person, get on the phone, get your parent, whoever is your caregiver, 911, I'm having a crisis moment, I need to go to the hospital. And then they'll do a 1013 or something and evaluate you and assess you for what you need to have, get you through what you're getting through. But if you know somebody in your family who has spoken like that, don't say, oh, they'll get over it. Oh, let's pray it away. That's something you have to act on. That's very important.
Thank you.
Did that answer?
It did. I just